My name is Heather Odden, and I am from Staff Education at Lifetime Care. I am also the medical and technical specialist on our COVID-19 Incident Command Team. So I am here today to provide education to you regarding personal protective equipment practices for home visiting staff. This is a system-wide education initiative, and we wanted to be able to bring this information to you, hence this video. So we are going to get started. You can see my screen here behind me. I'm just going to start up the beginning of the show here. Okay, so what we're talking about are PPE practices for home visiting staff. And what this refers to is what is the personal protective equipment you will be wearing as you are making your visits and working with your patients. So let's get into that. We as an agency are going to be using a universal masking policy. So this means that we are going to be wearing a medical mask, which is also called a surgical mask or a flu mask, when we are visiting with all of our patients. So in the picture you see here on the screen, this woman has on a blue mask. The ones that we provide through Lifetime are a yellow color. So we will be following guidelines in order to extend the life of our masks or the use. So stay tuned to later in the presentation because I'm going to give you some more specific information about that. But we are using masks with all of our patients at this time. So the PPE practices information I'm going to be reviewing with you today comes from a document that was put together about 2 weeks ago, and it is labeled Home Visiting Staff Personal Protective Practices for Management of Suspected or Confirmed COVID-19 Patients. Okay, so we are going to be going through this document piece by piece. Some of this will not necessarily apply. However, we want to provide you with the education so that you have had it. And we'll get to that with some of the specific instances. Now, if you look on the left-hand side of your screen, it does say the setting. Now, what is the setting most of us are working in? That would be the patient's home, or it may be an assisted living facility or another facility. But basically, most of us are working in patient homes. So that is the setting that we're working in. And we are going to start right up here on the top right-hand side of your screen, and we're going to go through this information right as it goes down with the document itself. And I'm going to say this quite a few times through this presentation, but if you have any further questions, please contact the office and talk with your supervisor. All right. So the first section we're going to be going over is referring to what equipment or personal protective equipment you would be using in the case of if you were caring for a patient that has been positive for COVID-19. Now, my understanding from Jean Chirico and Linda Andrews is that at this point, you are not visiting patients that are COVID-19 positive. However, we want to make sure that you have this information if anything changes in the future. So let's start. What is the activity? Well, that would be you providing direct care to patients that have been tested positive for COVID-19. So what would you wear working with those patients? That's what you see over here on the right. You would be wearing a medical mask. So like we said, that is the surgical type mask or flu mask, whatever you decide to call it. You will be wearing a gown, you will be wearing gloves, and you will be wearing eye protection. Now, mind you, that will likely be a face shield, and you will receive further information about face shields once we have them available to the agency. And then when you're working with that patient, we are going to encourage them to also wear a mask, okay? And that mask should have been provided by whether it's the nurse or whoever opened up that patient prior to you seeing them. Now, a lot of folks have questions about, well, what about those N95 respirators? At this point, the current guidance is that we are only wearing the N95 respirator if we are providing what we call an aerosol generating procedure with or to the patient. So that would be something such as doing a nebulizer treatment, open suctioning of a tracheostomy, using a metered dose inhaler. So these are things that you won't be doing with patients. More likely that would be the nursing staff. So then you would not have to wear an N95 respirator with our patients that are COVID-19 positive, okay? But once again, if things change, we keep you up to date. If you have any questions, then you contact your supervisor who can get in touch with me as well. But once again, for patients, we would only be using the N95 respirators if it was an aerosol generating procedure, like I already described. All right, what if we're working with a patient who has no symptoms, right? So the patients are being screened by your schedulers prior to you going out to see them. So this is a patient that doesn't have any respiratory symptoms. However, right, we're working in patients' homes. They have a family member or a caregiver that is tested positive for COVID-19 or is under investigation for COVID-19. Well, then what would we as healthcare workers have to wear? We would wear a medical mask, like we already mentioned, a gown, gloves, and eye protection, which will likely be a face shield. Now, the important piece of this is it is important to then ask that family member if they could potentially not be present for the time that you're making your visit and working with patients. And certainly, if you're doing personal care, that would likely be appropriate. And if you need any sort of or uncomfortable asking them to maybe isolate themselves, certainly touch base with the office or your supervisor about that because they can address that with the patients as well. So once again, try to have them not be present for the visit. And if they do have to be present, ask them to also wear a mask. Okay. So once again, let's look at some of the other situations where if the family members or caregivers are present at the time of the visit, when would we have them be wearing a mask? So that would be if they themselves were positive for COVID-19, if the patient was positive, and if they have been in contact with anyone that is positive for COVID-19 or in contact with anyone that is under investigation with COVID-19. So they would be wearing a mask. All right, so what about our patients that have respiratory symptoms, but it's not related to COVID-19 at all? So think about your folks that maybe have heart failure or they have chronic obstructive pulmonary issues, or maybe they just have really bad allergies. I know my eyes have been running these last few weeks as spring has started up. So they are respiratory symptoms that are not related to COVID-19 at all. So maybe it's these 4 bullet points that we see here. They're not under investigation at all. They don't have any, they're not positive for COVID-19. They haven't had any contacts with anyone that was positive or under investigation. Now, let me stop for a second and talk about what do I mean by under investigation for COVID-19? The technical term for that means that is somebody that has had symptoms and has been tested and we're waiting for those results to come in. But also we may have some folks in the community that they have had symptoms and for whatever reason their physician didn't think that they needed to be tested, or maybe there weren't enough tests to happen, or maybe they went and they didn't meet the criteria at the testing center. But maybe they were told that they likely have it. So once again, that would be somebody under investigation. So let's get back to what we were just talking about. But if we have a patient with respiratory symptoms, but it's not related to COVID at all, we would wear a mask just like we are for everybody. And we would also wear gloves with this patient. And if it's somebody with respiratory symptoms, we would ask that they also wear a mask if they can tolerate it, of course. All right. And then what if we have a family member or a caregiver that is on quarantine, however, they don't have any symptoms? So this is happening in the community. Maybe it was somebody that came back and had to travel on an airplane and they were told to be on quarantine, or maybe they had a contact at their workplace or somewhere where they were and they received a call that they're on quarantine. So those people are on quarantine, the family member or caregiver, but they don't have any symptoms, but they have to be there when you're making your visit. You once again would wear a mask and then also wear gloves. All right. So the next section we're going to talk about is how do we properly put on and then take off all of our personal protective equipment. And the information I'm going to be providing to you in the next few slides comes right from the Center for Disease Control. So these are CDC guidelines, but I also want to mention that some of this may apply, but some is specific to working with patients that are COVID-19. So I'll make those distinctions as we go through it. All right. What types of PPE you're going to be wearing will vary depending on the level of precautions required. So that's everything we just talked about, all of those different situations. So that's what I mean by that. But the first thing, if we are going to be wearing a gown, we would put that on first. Disposable gowns are a bluish color, that ones that come from Lifetime Care. Now, you will likely not need a gown unless you were told by your supervisor, because you, as of right now, are not seeing anyone that is under investigation or COVID-19 positive. But once again, we want to make sure that we're providing you with all the information we have if anything were to change in the future. All right, so the gown, make sure you put it on fully, and then you tie. If it has a tie at the neck and the back, make sure you tie them both. And then you would put on your mask. Now, we're going to talk in just a few minutes about a few very specific things when it comes to handling masks and putting them on correctly, and that will help to extend the life of the masks. So when you put your mask on, you want to make sure, and like I said, the ones that we have a little strap that goes behind your ear. So you want to make sure to try to avoid touching the mask as much as you can, but just the pieces that you're either going to tie or put behind your ears. And then once you place it on, you want to make sure that the bridge of the nose, it fits snugly against your face, and then it goes underneath your chin. And then if for any reason you're asked to wear goggles or a face shield, once again, when you're putting on that piece of equipment, you don't want to grab, it's like putting on glasses. You don't want to grab them by the lenses or the face shield by the shield itself, because then you're going to leave your fingerprints all over it. Well, that's not going to help. So you always want to grab it by the sides that will go behind your ears, or if it's the face mask shield, the piece that goes around your head. And then lastly, we put on our gloves. Now, if for any reason you are wearing a gown and you have gloves as well, you want to make sure to layer the gloves over your wrist, right? So if I have the gown that comes down to here, I'm pulling my gloves over the top of the gown. So therefore, I don't have any skin that is exposed. Once again, this is not something you will likely have to do on a regular basis, if at all, at this point, but once we want to make sure you have this information. All right, so now I have everything on. I've done my visit with my patient, and now I want to make sure to take it off. Now, interestingly enough, the sequence in which you remove these items is super important. And basically what we're doing with having a particular sequence is making sure that we're eliminating any risk of contaminating yourself. So whether it's contaminating your clothing, your skin, your mucous membranes, with any potentially infectious material. So that's why we're following a certain sequence with taking off our personal protective equipment. If you're working with a patient that is COVID-19 positive, once again, like I said, this is likely not happening, but we want to make sure you have this information. You will be disposing of your personal protective equipment likely outside of the patient's home. So prior to you going in, they will have talked to the patient about having a trash receptacle. So for most folks, it would be like the trash can in the garage, or maybe if they live in an apartment, it would be a trash can by the door. That is where you will want to remove these items and dispose of them as you're leaving. And let's talk about the proper sequence to take them off. And I forgot about this part. Before we do that, make sure that when you're going through the process of taking these pieces of equipment off, make sure you have your hand sanitizer next to you so that you can use that mid-process if you think you contaminated your hands or anything like that. And then obviously immediately after, because we want to be doing good hand hygiene after taking it off. All right, so the first thing you're going to remove is the gown and the gloves together. And the way you do this is you're going to be grabbing the gown from the front, right around the chest area, and you're going to pull it forward. They are disposable gowns. And what that'll do is that will release the ties that you tied when you put it on. And then what you do is you sort of start to roll that gown in using your hands. And what you're doing is you want to be rolling what was on the outside of you in, okay? So that as you roll, the part of the gown that was on your side, right, that was touching your body is now on the outside. And then as you get down to your wrists, you're going to be pulling your hands out of your gloves so that your gloves turn inside out, right? Because the inside of your gloves are clean. So then you're going to be rolling all the way down, you pull your hands out, and then you're going to be only holding it by the inside of your gloves. So let's look at a little picture here. So you see that person grabbing the gown sort of in B and C and pulling it forward. And then here in D, they're rolling that gown up, right? So the black part represents the part of the gown that was against that person. That's the non-contaminated side. And then they're rolling that possibly contaminated side in, right? So that it's covered with the non-contaminated side. And then you see here at E, they're pulling their hands out, turning the gloves inside out. And then once again, when you go to toss it or dispose of it in a trash can, you only want to grab the inside of your gloves because those are not contaminated. All right. Next thing we would remove would be goggles or face shield. Once again, you don't want to touch the front of them. You want to be able to take them off and they can be cleaned. So if there is a situation where you are asked to have to wear goggles or a face shield, we can provide you with information about how to clean them. At this point, you should not have to be worried about that, but we will provide more information for you. All right, and the last thing you would take off would be your mask or your respirator. Now, we already talked about, we're only using the N95 respirators for patients that we are doing aerosolizing procedures with, so likely you will not need one. But if you're working with a patient that is COVID-19 positive, instead of following our information about extended use of masks, like we're going to talk about just here in a moment, you would actually dispose of that mask. So you don't want to touch the outside of it. You would just grab it by the pieces that were behind your ear and then throw it out in the trash. And then obviously, once we get everything off, we want to immediately perform our hand hygiene. And that's why you want to have your hand gel ready, because if you're taking these items off as you're leaving the home, or ideally in the garage or outside of the home, you really won't have soap and water available to you at that point. So you're going to have your hand sanitizer ready. Make sure you get enough amount so that it takes about 20 seconds for it to dry, and you're making sure you're allowing it to dry so that you've cleaned your hands properly. All right, so I've been alluding to this a little bit, and I'm going to see if I can move my little face here so you can see better. Oh, this is pretty cool. My first time doing it. Okay, now, as I'm sure you have heard, it's all over the media, it's all over, it's not just us, it's the city, it's the state, it's the whole entire country, the whole world, truly. But there is definitely a limited supply, or somewhat, if you want to call it, a shortage of personal protective equipment. Now, we will always make sure that you have the equipment you need to be safe to see patients. That will not change. However, what we're doing is we are going to be good stewards of using personal protective equipment, and we are going to be able to reuse our masks. So let's talk about that a little bit. There are a few things that you can do to extend the life of your mask, okay? And truly, if we're able to follow a lot of these things we're going to talk about here, that mask, depending on what you're doing with your patient, how many visits you're making, you could wear that up to a week, potentially, if we're able to make sure that it does not fall under the situation where we would need to throw it out. So let's go through some of that information. One of the important things is whenever you go to put on any personal protective equipment, you want to make sure that you perform your hand hygiene prior, right? So we just talked about doing it after, but you always want to do it before as well. So make sure that you're always doing your hand hygiene prior to putting on your mask, okay? And it's important when you're putting on your mask for the day, place it, so put it on like we just talked about for our donning procedures. You want to put it on before you see your first patient, and then you want to leave it in place until after you see your last patient or do your last visit. That will extend the life of your mask, because obviously taking it on, taking it off, taking on, taking off, that causes some wear and tear. So you want to put it on, leave it on until you're ready to take it off at the end of the day. And once again, during the day, you want to avoid touching the mask, okay? And I know that takes some getting used to. We're not all used to necessarily wearing masks all the time, so we understand that, but you do want to avoid touching it. And you will be wearing that particular mask until it becomes wet. And obviously, we understand that if you're doing personal care with patients, that could certainly be something that happens. If it is visibly soiled, so obviously you can see that it has some sort of contaminant or dirt on it, or it's damaged, right? So damaged, what do I mean by that? Well, it doesn't fit well anymore. It starts to rip or something like that, visibly damaged, okay? Now, when you're going to take off the mask, we just talked about some of this, but a couple other things just to reiterate is that you want to make sure your hands are clean, okay, prior to taking it off at the end of the day. Only once again, touch those ear loops, take it off and look at it. Okay, does it have any obviously soiling? Is it ripped anywhere? Does it have any damage? And then what we're going to be having you do is store your mask in a paper bag. So you will be provided with a paper bag. Now you might say, well, Heather, why do I have to put it in a paper bag? Well, what that does is it allows the mask to breathe, right? But basically to get airflow. Because when we breathe, our breath is humidified, right? It's not just dry air usually. So that could cause the mask to potentially have some moisture on the inside from our own breath. So that putting it in a paper bag will allow it to get airflow and it will allow it to dry overnight. So that's the other piece is that you want to have it and store it in the paper bag. And then you just want to keep it nice and safe. And then it's ready for when you're getting ready to go and do your next round of visits, whether it's the next day, the next over the, if it's over a weekend or something like that. So once again, if you have any questions, oh, I'm sorry, I forgot my last point there, but masks, I did say this earlier, but masks could actually be worn for up to a week if they're not wet, soiled, or damaged. So those things we already talked about. So these are things that we can do to extend the life of masks, okay? All right. Now, if you have any further questions, I want to encourage you to reach out to the office or your supervisor for any further guidance or questions because we're here to answer that for you. So I want to take a moment to thank you for tuning in today. I hope this has provided you with some really great information and clarification. And once again, just reach out to us at the office and we can provide any further guidance on any questions you may have. Thank you so much and have a good rest of your day.